Okay, so congratulations to both of you, Roshan and Abhishek, for being with us. Uh,
And
Roshan, can I just have a short introduction of yours here?
I'm Dr. Abdullah Roshan from Kerala. Actually, I'm second rank holder in FNB exam in the 2022 exam. I did my UG from Calicut Medical College, and later I did my PG from PG in EMS Orthopedics from Government Medical College, Thrissur, which is in Kerala. And I had an bonded service for 1 year. In between, after 6 months of my bonded service, I gave the exam, and thank God I got a good rank. And now I am working. I have joined in FNB Sports Medicine and Surgeon, Sports Injury Center. That's awesome.
So Roshan ranked to a remarkable achievement and then a big jump across the country, right from Kerala to Delhi. So how's the feeling? His video is breaking.
Sure, sir,
Roshan?
sure. I'm very
Yeah.
much satisfied.
So pretty much
I never
satisfied?
expected such a good rank actually. Very much
Okay.
satisfied, sir. Actually, I have interacted with you earlier, even during my preparation. I was expecting only a rank within 30, and I was planning to join for arthroplasty somewhere in my area only.
Okay. So,
Unexpectedly, fortunately, I got a good rank and I got admission in sports injury center.
so you're enjoying the feat. That's great. Abhishek, would you please also introduce yourself a little bit?
hello, sir. I did my UG from Rama in Bangalore, and I did my
Yes.
PG in Bangalore Medical College, and I completed my senior residency, the 1 year bond in BMC. And a couple of months later, I got my FNB rank, sir. And I am currently working in Ganga as a sports medicine fellow.
Great. And you are happy with your result?
Oh, yes, sir. Yes, sir. Unexpected.
Okay. That's great. So guys, really useful to have you here. And perhaps, I would ask each of you one by one to share a little bit of your preparation strategy. So Abhishek, you're online right now, so we'll just start with you. People often have pretty much of doubts like what is the required time duration if one has to prepare nicely? How many hours per day have to be put in? How long a preparation is required to crack an exam with a rank like yours? So, what's your take on that?
So for me, the thing was I completed my senior residency couple of months before the FNB exam began. So I just took a break for a couple of months and I prepared the like a proper prep time kind of a thing.
Okay. So, is 6 months a good enough duration?
6 months is more than enough if you're actually giving a daily 2 3 hours time. I think it should be more than enough.
Okay. So, you mean to say that one has to be regular, giving maybe 2, 3 hours at least,
Yeah, yeah.
and
Regularity is most important.
regularity is more important than the duration. And if you are regular, 6 months you feel is good enough.
Yeah, yeah.
Fair enough. So, you were lucky to manage a little bit of that off time
Yes, yes.
after your senior
The
residency,
timing was
whatever.
ideal. Yeah.
Yeah. And Roshan, was it something similar on your side also? You were able to manage some time off, or you had to prepare side by side with your work?
Actually, I was, as I already said, I was in between my bonded service. I took leave for 1 month from service actually, senior residency.
Okay. And how early you started the preparation? Like maybe 5, 6 months only, or maybe a year or two?
Actually, even during my first year of PG, in the back of mind, I had a plan that I have to take something. I have to subspecialize in something. Why? Because while I was doing my first year PG, there was one senior resident who came back after doing FNB spy. From that only I knew about this FNB course actually. So in the back of mind, I actually had such a plan. And even during my final year university preparation, Actually, in the back of mind, I had a plan of FNB, and I was doing MCQs in between actually.
Okay, so you mean to say that the vision one should incorporate right when you enter into orthopedics, that orthopedics is no one end branch, you have to super specialize. So that vision has to be there right from the word go. And then, when those final 6 months come, you have to give up that best roundup in the best possible manner, perhaps, ensuring that regularity, as Abhishek has talked of. And 6 months, as per both of you, I feel that is a good month time for preparation, as you guys have told me. All right. Roshan, what was the reading material you counted upon to crack this field?
Actually, I already said that I was doing senior residency for 6 months. Before that 6 months, I was preparing for final year university exam. While I was preparing for final year university exam, I was reading for theory exam. At the same time, I was doing MCQs from the ortho bullets also.
Okay.
At that time, I didn't have much contact with the Target Ortho team actually. Later, during last 2 months, I really used Target Ortho actually.
Okay. So you combined bit of help from ortho bullets with target ortho to practice the MCQs.
Yes, sir. Yes.
Okay. Any other books or textbooks from where you sought some help during these final days of preparation?
No, sir. No, no.
Okay. So you solely depended upon these online platforms
Yes.
for building up your knowledge.
Yes.
Okay, fair enough. Abhishek, what's your take on this? Like, what are the good reading materials one can look up for in case, they also want to achieve a feat like you?
No, I also was on mostly dependent on ortho bullets and target ortho. I had made my MS notes, so I used ortho bullets and just added on to the my MS notes.
Your MS notes. And
Yeah.
Abhishek, what's your take on the 3 years of that post-graduation? How much do you think that part contributes? Like, if you're serious with those 3 years, how easy does it make your journey to FNB?
Oh, definitely. If you actually have the mindset from the beginning and you solve some MCQs, so you'll have that orientation. Because when I studied MS, I had no orientation for this, so I had to actually go back and read with the mindset of solving MCQs. So that took a little more time.
That took a little more time. So you think that, maybe you could have jumped a couple of ranks higher had that
No,
orientation vision come maybe a
maybe.
little early.
Yeah.
Maybe, yeah. So I can get it. So perhaps, what I can take, the answer of the house again, that the vision has to come early. And when the time comes, you have to give it the perfect roundup. Regularity is important. And perhaps, somewhere down the line, that knowledge of PG will also be carried forwards. So you have to be serious right during your PG years also. And when it comes down to those final, last couple of months or 5, 6 months, the online platforms, maybe like Orthoplay, Target Ortho, they're very dependable and they can be followed to brush up that knowledge you've already attained in your 3 years of PG, maybe in senior residency. Fair enough, guys. A lot of people ask me, perhaps that should they be reading books like Miller's? Should they be go back and reading Campbell or some basic books they follow during your PG years? So Abhishek, did you also go through some of these kind of pieces of literature?
No, nothing. I
Not much.
Yeah,
Okay. And perhaps you think Orthobullets combined with Target Ortho was good enough to give you all the
yeah.
relevant information? Fair enough. Roshan, did you also read some textbooks, theory books, or some other pieces of literature?
No, actually, I didn't read any textbook other than Dr. Siddesh Gopalan, sir. That was too in the university exam preparation only.
Oh, that was in the university exam. But for your FNB preparation, did you also depend on some textbooks?
No, sir, no. I used
Not
these two sources only.
okay. But were you satisfied in the end that these online platforms and the material they have provided, they have covered up all the concepts and all the material?
Yes, definitely, sir. I feel that. I feel
Okay.
so, sir.
So you mean to say their combination makes you pretty much complete, that even if you've not touched a theory book, you would easily be able to get through if you've done them and devoted time nicely. Okay. Because uh once you're done with your PG, it's never easy to read a textbook. In fact, when we worked on Target Ortho, we worked with a very clear plan that the orthopedic, literature has to be divided into topics. So that's how you see MCQs on the website. Because I think sometimes it's easy to read topics and sometimes maybe unrelated topics, but reading whole chapters is never easy because you have to manage your preparation side by side with work. So that's what the trend I have seen, as I've interviewed some elite people like you guys, that more and more people are depending on now these online platforms. And perhaps, they're more now reading the high yield material rather than reading the textbooks. And that's what my advice would be to the youngsters also, that, this is getting a very competitive exam. And perhaps, reading high yield material, correct material, and authentic material is the key. Otherwise, you end up wasting time. And then, you need long years of preparation. Uh, I would like to start with you, Abhishek, for this. So, what do you think was the contribution made by Target Ortho in achieving this feat?
The most important thing was the orientation because I didn't know what kind of questions the FNB asked. So I was little aloof in that way. So when I actually solved that one question papers, then I realized what kind of preparation I need to do. So it was helpful in that way. And the type of questions, the ortho bullets, even though the reading material is good, the questions are not related to how FNB questions are. So it's a bit different.
Absolutely right, because Indian pattern of them is little different,
Yeah.
and the purpose is little different. Fair enough. Was the material on Target Ortho, that question bank, adequate enough to cover all areas?
So the target ortho caters to the tougher part of the FNB. So definitely, if you have covered your basics, the target ortho is enough for the
Enough for that.
outlier.
Fair enough. Uh, Abhishek, did you take help of the video lectures also, because there's a big video library that's available?
Not I use the subjects where I was not strong in, like where I had doubts, like scopy, sports medicine, which you don't study in during our PG, and spine. Whatever topics I had doubt in, I used to see the not the whole library of.
So you use the video library in a selective way,
Yeah,
and perhaps you made sure that you eat up all the MCQs and the
yeah,
reading material, and you feel that when they are combined, it gives you almost a perfect touch of at least all the difficult areas that are going to be troublesome for the
definitely.
FNB exam. Well, perfect enough. And Roshan, you've also been long as a Target Ortho. So how's your experience been with Target Ortho? Helpful in your
Uh,
preparation?
Definitely, sir. Definitely. Yeah. As I already said, I took leave from my senior residency for last 1 month of my preparation. And I was almost using 10 hours per day for learning actually.
Okay.
Before that 1 month, actually, I was using ortho bullets majority of the time because I was not used to target ortho actually. But during my last 1 month of preparation, the best benefit I got is that got from target ortho is that it combined all together the important points all together. I think it was the main benefit I got from the target ortho. I think. In orthoblast, the information is much scattered, but in target ortho, I believe that in arthroplasty section, in arthroscopy section, in spine section, these are three majority areas, right, sir? From these three areas, if I'm going through the Q bank and explanation, I think that majority of the questions will be from those Q bank and explanation, I think, sir. So for last 1 month of preparation, it gave me a huge advantage. I believe so.
Okay. Dr. Roshan, did you also make use of the video library?
Actually, I was regretting that I couldn't use these videos much. but I watched a few videos only, I think, sir.
Okay, perhaps because of the time constraint also.
Yes, sir. Yes.
But yes, so both of you watch the videos in a selective way, but with great help from the reading material. Fair enough. Abhishek, there's a WhatsApp group also where you can ask your confusions and maybe discuss. So, Abhishek, were you all always going through that WhatsApp group, the discussions and the questions?
Oh yes, yes. That was, I think, one of the most important bits because I would uh, realize what all doubts I didn't have also, and it would
So,
keep me active, and you realize other people are also preparing, so it keeps me oriented.
yeah, so that keeps you going, that gives you the kick. And perhaps, I can recall that there was a question that was asked to me 2 days prior to the exam, and I happened to answer it a day prior to the exam. And surprisingly, that question was there in the exam on prostatic joint infections.
Yes.
So in a way, so you felt help from the group, okay? And Roshan, was that group also on your uh, mobile all the time on the active side, peeping with messages, and you were watching over?
Definitely, sir. It was very helpful that even while my senior residency, it gave me a huge benefit from this group actually. When I was doing surgery, when I was planning for surgery, I put X-rays in the group, and I will get different opinions from different faculties, and it was very helpful during my senior residency also. And also while my preparation for FNB, it was very helpful that each and every query will be answered. That's a different thing about the target or the discussion group, I think, sir. Each and every query will be clarified. That's the very best part of it, right? I believe so.
Wonderful. So your feedback would keep us going. So we'll try building it even better and better. Roshan, did you give the mock tests also at Target Ortho?
Yes, definitely, sir. I have given, and I got a rank of 15, I think, sir.
Yes, I know. So you scored well also. So how's your experience been with the mocks? You think they somewhat simulated the exam? They were equally tough as the exam was, and they were relevant enough with the same distribution of questions?
Yes, sir, definitely. It was actually a real simulation of the exam. And also, I believe that it was little bit on tougher side, so that we had to prepare in such a way, I think, sir.
In such a way. And Abhishek, you also paid in the mock tests,
Yes, I had scored the fifth rank in the mock.
the fifth rank in the mock. So perhaps you've both been into the toppers and you topped over here. And I think perhaps because many people, most of the people I would say who appear in the exam, they get connected with us at Target Ortho. So in a way, you very well get a real simulation of the exam and your ranks. Because even previously also we've seen that most of the toppers who topped the exam were toppers with us also at Target Ortho. And perhaps with you people shining, I'm sure that tradition will keep on going. That'll always be there. So one small thing I would like, where both of you have to be involved and answer, uh, because that's perhaps the first thing that comes to anyone's mind who even thinks of preparing for FN. See, the preparation is tough. The exam is no way easy, and at times a person who's even a teacher can fail. It's such a tough exam. So one has to take a strong decision and a decision with determination to prepare. Now, before preparing, some easy options always come in front of you. Pursuing with senior residency only, maybe starting your private setup, or maybe going in some fellowships that are very easy to fetch, and sometimes even the paid fellowships. So all those options are there in front of you also. So Abhishek, may I know your choice on it? Like, why only FNB? Why you chose to give this exam and take so much of hurdles when you had so many easier options available with you? So you
Uh,
see some distinct advantage with FNB?
and my professor was guiding me in this. He was very clear in the fact that I should do a degree, certified course so that it's future proof. And any fellowship I could anyways do it later.
Okay,
I can't
perhaps
study
so.
later for an exam.
Perhaps yes, absolutely right. So there can be an FNB and then any fellowship, but even after fellowship, that tough decision to give the exam is never an easy choice. Yes, makes sense. And perhaps, you use that word certified course. So which means a curriculum that is uh, more sleekly designed, and perhaps, a training program that is more precisely designed is always better than, of course, a random fellowship. Perhaps I can agree. And uh, Roshan, what's your take on it? Like, is it as good as, going for those fellowships? Or no, you also feel that FNB is distinctly and definitely better than that?
Yes, sir, definitely. Actually, my one of few of my seniors were discouraging me on FNB actually. But actually, I wanted to do an FNB course actually because um, I wanted to do cases in ideal way, and I had to do in the I had to learn the best way actually. That's why I chose FNB course actually.
So long ways for you to go, guys. And perhaps, our wishes and blessings will always be there with you. But, if I share my same views, because, I am little ahead of you, I've gone through the whole course long back 2014. So what my take on it was that if you ask me that did the plethora of jobs open up for me post FNB, I would really say no. But I certainly found a distinct difference in my practice. Now I was the perfect, case control for uh, my case study. I was working at the same place. I did my FNB and I joined back at the same place. My outpatient, the patient numbers drastically changed. So when I came back and rejoined at the same place, the adjacent rooms became empty. Perhaps I think, somewhere down the line, my confidence level increased. My level to accept challenges increased. I became more refined with my skills and techniques, and of course, with my knowledge. So for the same thing, I had more alternatives. I had the cheaper versions available. I had the easier and minimally invasive versions available. So that's what my take on it was. So that uh, instinct that comes in you, that you have to read, you have to be disciplined, you have to be determined, because now you are doing a certified course, and perhaps a course where you will have an exit exam, keeps you going. Like, that exam that you had to give made you read so much. So that's what I would, ask you to also be careful about. Make these 2 years count. You will have an exit exam coming your way. So read, and not just sharpen your clinical skills, sharpen your theoretical skills, because both the skills tend to complement each other. And trust me, you guys will also see a difference with your skill and a difference with your confidence when you're through with this course. So it's been great to be associated with you both, guys. Best wishes from the whole Target Ortho team. The way you've made us proud, that keeps us going. And we would love that you stay associated with us, even as you pursue and move ahead with the course and with your life. So all the
Thank
best to both of you, and great to be associated with us.
thank you so
Thank
much.
you.
Okay, so the formal discussion is over. And Roshan, you are there at Sabdajan. So I'm not
Yes,
there
sir.
on Mondays and Fridays. So any
Okay.
other day you can meet up. And Wednesday I generally tend to be in the OT. But Tuesday, Saturday is very good time to catch over.
Tuesday
Tuesdays,
and Saturday.
Thursdays, and Saturdays.
Oh, okay. Then I try to catch on Saturday, sir.
Yeah. So when you
Tuesday
sometimes
I'm having
you
OT.
get free, suppose in time, and it would be love to see you, because Abhishek,
Sure.
we've tried a bit, but unfortunately when he gets free, I get busy. So that's how things been happening.
Yeah.
And Abhishek, how are you finding Ganga otherwise?
It's good, sir. It's a little hectic, but it's a very good place. Lot of we have 4 OT days. It's a very good place.
Okay. So do they allow you a little bit of arthroplasty exposure also or no?
No, no. So, but we have foot and ankle exposure, sir. They have a very good foot and ankle. We It's a unit is both OP and foot and ankle.
Wonderful, wonderful. Uh, do start reading also side by side.
Yes, sir.
You, both of you guys, you've chosen sports medicine. So now you will realize that sports medicine is way beyond arthroscopy. So you will have to go through some sports medicine books. Uh, I'm carrying some books with me also. That'll be very helpful to you. So for arthroscopy, I went through Donald Johnson, which is a very good book and covers almost all arthroscopy. You will have to read bit of plasty also. At least Roshan would have to, because at sports injury there's a simultaneous exposure,
Yes.
almost equal exposure. I'll guide him when he meets me, and you guys will need to read bit of exercise physiology. It's a very small and a very nice, excellent book I have with me by the name Instant Notes. So maybe you guys will just drop me an email and I'll send you those ebooks.
Thank you so much.
Yeah. Make sure you guys go through once again that some good clinical examination book you read in your PG. Like I went again through Bruckner and Bruce Reader. I read that up.
Please read it.
So revise one of the clinical book, because exam maybe you will have to demonstrate the clinical skills. And sports medicine you will have to read selectively, like you mentioned, about the video lecture selectively. A book called Bruckner and Khan. What Campbell is to us is Bruckner Khan to the sports medicine people. But in the end of it, you will find those all chapters, sports medicine for a pregnant athlete, for an old athlete, uh, sports concussion, that cardiac arrest, all those kind of things. So all those questions will also be there in the exam. ठीक है, तो वो सब पढ़ना पड़ेगा. But anyway, down the line, if any confusions, please feel to call up and ask and connect with me. We'll always be there to help. Okay, and sometimes we need some writing help material for, and we need some other input. So in that scenario, we'll keep on disturbing you, because we
Sure,
also want to
no
maintain the
problem.
access. Okay, sir?
Yes.
Okay, Roshan.
Sure. Sure. No
So
problem.
wish you all the best, guys. Stay in touch. Many congratulations once again, and all the best.
Thank you.
Yeah.
Thank you so much.
Bye bye.